So the Women's Pelvic Wellness Program is a multidisciplinary clinic.
This is the only program of its kind in the state of Wisconsin. There are other areas that have, single specialties or maybe a doctor and a physical therapist, but this is the only one in the state that has multiple specialists in the same area.
There are 2 urogynecologists who are OB/GYN trained and 1 urogynecologist who's urology trained. And so the 3 of us are there with our individual expertise, and then we have a colorectal surgeon and a pelvic floor physical therapist.
It's kind of like one-stop shopping. All the key players are here or available in the clinic so that we can easily talk back and forth amongst each other about complex cases.
We're set up really to see patients with more straightforward problems all the way through to patients who would benefit from seeing someone from more than one specialty. So not only Dr. Giles, Dr. Brown, and myself, but maybe also physical therapy at the same time, or also the colorectal surgeon at the same time.
So I should back up a little bit and talk about urogynecology, because urogynecology is a field that takes care of the pelvic floor, which includes the bladder, the bowels, and all the muscles and ligaments, plus the reproductive organs, the uterus, the tubes, the ovaries, and that kind of stuff. So urogynecologists take care of everything in the pelvis, whereas a colorectal surgeon mostly just focuses on the bowels.
I think from a urologist background, what do we think about? We think about things above the pelvis a little bit more, so we tend to think about the ureters and the kidneys and how those are incorporated into pelvic floor function. And then maybe perhaps disorders very specific to the urethra and perhaps to bladder function itself.
So I would say our bread and butter is going to be pelvic organ prolapse, problems with urinary leakage or urinary control, and problems with bowel control issues or accidental bowel leakage.
Anybody has any type of mesh complications, pain from mesh erosions, we do a fair amount of surgeries to fix that.
Problems with urinary incontinence or problems with urinary retention.
Or problems where somebody's not born with the right size vagina or normal size vagina.
It can be problems with support for the uterus, which can manifest as prolapse symptoms.
We also work on complex fistulas, which are openings from one area to the other. A hole in the bladder to the hole in the vagina where you may leak urine all day long.
In the posterior compartment with the rectum, that can manifest as constipation or difficulty emptying your bowels, difficulty emptying the rectum.
The opportunity for us to provide interdisciplinary care at one time is phenomenal. I've never had this experience in a care delivery system ever, where I'm doing a pelvic exam with a pelvic floor physical therapist next to me, and she's seeing the measurements that I'm doing and how I take my measurements, and then I'm seeing how she assesses the strength of the pelvic floor, and we're together coaching and counseling. And we've both said, wow, it's so funny, we've read one another's notes, but it's really different to see it in real time.
It's that collaboration between different specialties that I really enjoy.
We're able there in real time to chat with the patient, tell her what we're finding. I mean, it's state of the art. It is really a unique place. I'm so excited that it's happening.